Did you ever notice how celebrities have such perfect, smooth, beautiful young skin when you see them in movies, on TV, social media, and the internet? Well, today you're going to find out because we have one of the leading cosmetic dermatologists in the USA on our show today. It's Dr. Elizabeth Houshmand, and Dr. Houshmand practices dermatology in Dallas, Texas, and you can find out more information about her at HoushmandDermatology.com, her website. Hi, thanks for tuning in to episode number 87 of the Doctor Podcast Show. We really appreciate you joining us. And please subscribe and follow Doctor Podcasts and also like, repost, and share this episode because I'm sure you'll learn a lot and all your friends will want to know it as well. So, Elizabeth, thanks for taking the time to join us today on the Doctor Podcast Show. I really appreciate it.
Thank you so much for the invitation. I'm greatly looking forward to discussing all the hot topics in dermatology with you this evening.
That's great. Speaking of hot, it was 11 degrees in New York City this morning, and now it's a blistering 21 degrees. What's it like in Dallas today?
Dallas is in the 60s. It's really nice, but I'm originally from the East Coast, so I'm well
Oh,
aware of that weather. I chose to go down south to get out, away from it.
good idea. Good idea. So let me tell the audience a little bit about you. You're board certified in dermatology and in internal medicine, two different boards, which is very impressive. You're a fellow of the American Academy of Dermatology, a fellow of the American Society of Laser Medicine. You specialize in cosmetic dermatology, laser medicine, surgery, acne, hair loss, and melasma. And you're also an international speaker, trainer, author, and medical news correspondent, internationally recognized leader in cosmetic dermatology. So you have incredible credentials, and we really do appreciate you joining us today. So I'd like to start out by asking you if you could tell us what is a dermatologist and how many years of training does it take for you to become a board certified dermatologist?
I greatly appreciate this question because I think in this landscape with social media, a lot of people say that they're skin experts. So, what is a dermatologist? We are physicians. Dermatology is a specialty so you go to undergrad for 4 years, medical school for 4 years. You then do at least 1 year internship, and then you do 3 years of dedicated skin, hair, nails, surgery studies. You can then go on, like I did, to do a fellowship if you like in cosmetic and laser, Mohs surgery, pediatric dermatology, dermatopathology. But dermatology itself is an additional 4 years total after your medical school training.
Wow. So the total is 13 years.
And
That's a
then I
lot of,
did an additional 3 years of internal medicine, which I love and has helped me tremendously because your skin is your largest organ. And what I love
right,
about dermatology is you really have to be the master of all the organ systems. Sometimes you'll walk in the door, and if your eyes are yellow and your skin is yellow, I know that you have liver disease before maybe someone does blood work on you. And patients are always amazed when I know that they're diabetic. I know this. I know different things just based on looking at them and looking at their skin. And they always say, "How do you know that? You're my dermatologist." And I said,
right,
"Because we are like this detectives of the body, if you think about it."
right. It's kind of similar to ophthalmology in some ways. I'm an ophthalmologist. I can tell certain diseases and conditions by looking in the eye. But skin is even better because you have this huge surface area and it's much easier to see the skin than looking inside an eye. So,
Absolutely.
what conditions do dermatologists treat?
So we see from infant, I personally see from infant to geriatric. We see the rashes, skin cancers, acne, rosacea, obviously. I take care of bites. So if you get bit by a bug, I'm the one that can help you out and tell you potentially maybe what bit you based on the patterns. We also do obviously a lot of different types of procedural things. If you have a skin cancer, we can help you identify the type of cancer, do what's called a biopsy or a sampling. Then we can do an excision. There's Mohs surgery for different sites. And then, of course, the things that I love to do, I love treating hair loss. I love treating, we treat psoriasis. We treat so many different things, eczema, melasma, all types of hyperpigmentation. I can help beautify people, get rid of some wrinkles, skin health and overall wellness. So just, it's a wonderful field because we get to, like I said, really take care of a lot of people. And the things that I treat, you see. Someone that has psoriasis, I think the psychosocial impact on their work, their personal life, if I can help you get rid of psoriatic plaques or your eczema, you'll be able to function better at work. Or if I can help you with your hair and it's not falling out, it's a big factor. So I really love what I do.
Right. And as you said, you can see the results, which is very important because patients obviously benefit from that. So when should a person start to see a dermatologist? At what age?
It's an excellent question. So, if you have any family history of skin cancer or melanoma, I do think it's wise to start earlier. If you have ever used a tanning bed, if you have ever had a blistering sunburn, please come in and see us earlier. Those put you at higher risk. This last year, I think within a 6 month span, I had, want to say about seven or eight. Luckily, melanoma in situ, that's the most superficial in patients 50 or younger. That's pretty young. So it's not based on age always. There is a hereditary component. And so the sooner you come in, if I catch something that early, an MMIS, you have a 95% cure rate. We can cut that off. There's nothing further. We watch you a little closer, but a lot we can do. So if you ever see a dark spot that's new, moles that are new, please come earlier. But you should come once a year for a good head to toe full body skin check.
Right. And at what age would you recommend? Let's say there's no family history of any skin cancers or
I think if
melanoma.
you've never had a sunburn, never used a tanning bed, otherwise healthy, maybe in your mid to late 20s.
Right. Just about everybody's had a sunburn. I used to sit there with my reflector, not realizing that the UV light from the sun was harmful. So I get my skin checked annually, as you mentioned. So that's very
Excellent.
important. Now, one thing I noticed about you that was very interesting and also very impressive is that you're not only board certified in dermatology, but you're also board certified in internal medicine, meaning you're an internist. Could you tell us about that and how
Sure.
that occurred?
So I always knew that I wanted to do dermatology, but I really was inspired, I think, by my father. My father's a physician as well, and he's hem-onc, and so he did internal med. And I always felt like they were the smartest doctors in the hospital. They knew everything.
Right.
I think they're the unsung heroes, to be really honest, of medicine because they really know every organ system, every disease. And I really am grateful for that training. So that when I went, I knew I wanted to do dermatology. And at that time, there were no combined programs. Now in the US, there's several combined programs where you save a year. But I don't, I think it helps me tremendously. So if I see an advanced connective tissue disease, I feel very comfortable handling and managing their labs. Sometimes when my patients take their blood work to the lab, they're like, oh, this is the dermatologist. They're ordering this and they're surprised the things that I'm ordering. But I feel like in this day and age with medicine being so it's a different age even I think from 10 years ago when I was in training everyone, you want to take full care of your patient, meaning comprehensive care. And I hate to send them back to their primary care just to tell them to order something. If I can handle it, For example, like for my hair loss or my psoriasis patients, I always tell them they have to see a rheumatologist, and I tell them why, because of the psoriatic arthritis, but I'll gladly order the imaging studies. I'll gladly order whatever else they need to save them that time, save them that visit. Now, I will say a caveat. Insurance companies are not very kind when I order things. They usually will deny it because I'm the derm, and then they have to get their primary care. So I sometimes give a call to the primary and say, "Hey, I'm doing this. If it gets declined, would you mind?" And they appreciate that.
That's great because when I see patients who I think may have some underlying systemic disease, I have to send them to an internist always.
Yeah.
Whereas you can start the ball rolling early and get results quicker. So that's great. So internal medicine was a 3-year residency, and then on top of that, you did your 3-year dermatology residency, right?
Yes. So
That's
I added some years, but I think it was one of the best things that I did. And I feel once I started practice, there was nothing that walks in the doors that kind of surprises me or I haven't seen. I feel very lucky to have trained. So I did my medicine residency, my training at Georgetown in DC, and then I did my dermatology at Wright State. So we trained at a VA, a children's hospital, an indigent clinic, private clinic. So I've seen everything. And I think that is really important. I think, when you're a student, you don't realize that where you train is so critical, like where you're going to be rotating. Will you have opportunity if you're going to be doing something surgical to operate? At the VA, we had such a wonderful experience with the veterans operating their children's. That's why I feel comfortable to see pediatric patients. And so your training does matter, skin of color. I saw a lot of different ethnicities throughout my training, so I feel that helped me quite a bit.
and your patients don't even realize what advantage and benefit they have by seeing you as opposed to other dermatologists who obviously have excellent training, but you have that extra 3 years there, which makes a huge difference. So your patients are really benefiting from that.
I
Now,
appreciate you.
yeah, yeah, that's great. Now, how is we mentioned social media earlier and all the people with beautiful skin that look like they're teenagers on social media. Tell us how social media has changed your practice, and do you think social media is helpful for you as a dermatologist?
So I am a very private person in my personal world, and I did not have an account when I first finished. So I didn't have one at all during residency. I did not have one even my first, I think, 4 years. It was actually through a company was launching a product, and I was going to be the speaker for the product, and they were having an influencer event. I looked at them and I'm like, what's an influencer? I really didn't know. And they explained to me the concept. They told me the beauty editors would be there, this, that. I didn't give it much. They said, you have to have an account. I said, okay, I will make an account. I took a selfie of myself. If you go on my account, that picture's still up. I literally took this picture right before the event. I thought, fabulous, I have an account. When I went to the event, though, I had first of all, I was super, super embarrassed of my ridiculous account with one photo. These people had millions of followers. The beauty editors were from Town and Country, Esquire, like these very big publications. And I realized this is their job. They report on beauty, wellness, health, and to such a robust following. And I thought this is actually really interesting. You can market yourself, share information if you want. It's almost like your own branding and such a cool opportunity. After that event, I followed a bunch of them. They followed me back. They reached out, had nice conversations with. It's imagine going to multiple dinner parties all across the country and world. So I think it can be wonderful. For me, it's been an educational tool. This last 2 years, I've been the chair of our American Society of Derm Surgery social media committee, where we as a group of dermatologists get together to put out content to help educate the public. I think it can be really good or it could be really bad. People want to my job is to educate. I'm not trying to sell you something. I don't have my own Hooshy hairline or makeup or skincare. I just want to share information with you. So I'm not, if I tell
Right.
you I like something, I like it. And if I don't like something, I'll tell you because I'm not gaining anything. But I do think in this world where people have their own vitamins or supplements or this or that, and they
Right.
want to sell something, there could be some misinformation. So I think know who the people are. I do think credentials matter. I think evidence-based medicine has to be the source. There has to be a publication. I can't, unless I say I like something just because I like it, but I have no research, I should disclose that. I think that's okay, but you have to be, as physicians, I have to tell you from a medical standpoint, if it's safe, what are the risk benefits, because there's risks to everything that we do. And so we have to, the same way I would treat you in clinic. The bad side of this is I think there's a lot of pressure on younger and younger patients. I've been interviewed about 6 times, I think, in the last 4 months by different beauty outlets about the whole Sephora kids and Ulta kids. And it's a group of young people that go to those stores to buy very expensive skincare products.
At what age? How young are these
I
beauty people?
had an 8-year-old that was brought in by her mom. Mom went with her to buy the product, but they thought they were buying just a simple moisturizer, but it ended up having an active in it. So she came to me for a allergic reaction to the active in there. But I can understand. I think there's a good side. The good side is this generation knows to wash their face, knows about sunscreen and wears sunscreen. So I think it can be used educationally, but I hate to see such young people consumed by purchasing skincare or makeup or any of those things. I don't like that they have that pressure on them.
Sephora loves it.
I mean, it's not just them, it's online, it's
Right.
all over.
It's everywhere.
I think people label Sephora, but it's really, I think it's up to the parents and the family to help educate. I love that I'm seeing them in my clinic to tell them they don't need certain things. It's usually telling them that they don't need this or that. Usually the age that I start to see younger patients are those that are having some mild acne at an early age, maybe like 10, 11, they're coming in. But I don't like to promote unnecessary skincare.
So, what's the latest skincare hype on social media these days?
So I don't know if you've heard of beef tallow. This has been a big thing that everyone's talking about as the latest and greatest, that it helps with acne, that it does this. So beef tallow is basically the fat of the beef. It has stearic acid, palmitic acid, oleic acid, and those are fine if you have really dry skin, but I don't think it's beneficial for acne. I don't have any evidence-based science to show that it would be helpful, but there is a strong movement for chemical-free organic products. And a lot of people are saying that this really helps and works. Again, would imagine that it would actually clog your pores and cause some acne
Yeah, it's
if you
very
want.
thick.
It's very thick, but some people are swearing that's it. But as I said, I don't have any studies to say why it would work. And so I shared that I think we have better things.
Right. Where do you get beef tallow? Let's say I wanted to buy some.
Amazon.com and the internet.
Really?
Apparently, there's a lot of different brands. In doing
Wow.
my homework for the article, I Googled, beef tallow, and you can buy it online pretty accessibly. It's not sold in like a department store or in some of these beauty stores,
Hmm.
but definitely get it. So that's one. And bean shampoo is the other one I was asked about.
Bean
Bean
shampoo.
shampoo, black bean shampoo is very popular in Asia, in Korea especially. That has some proteins and things that can help with the structure of the hair, but it's not going to grow your hair overnight. I don't think it'll hurt you. I don't think it'll be a wow. I think it's okay. It's somewhere in the middle.
Wow, that's amazing. Now, the beef tallow thing is interesting because you know there's a epidemic of bird flu in dairy cows around the country. I wonder if beef tallow may contain some bird flu virus. I don't know. How do they process it? Do you know?
Interesting. I'm not sure on the
Hmm,
specifics of how they process it. I think that anytime you have a DIY or something sourced from an animal, you want to be very cautious
right,
as to where you're getting your products. That's like people that were doing DIYs for making your own sunscreen. And you can't do that because the formulas are so specific and the ingredients and the concentrations and the percentages to get that SPF. The whole reason to use SPF is to protect yourself from the sun and skin cancer. If you don't have the proper concentration and formulations, I am not a chemist. I don't make my own sunscreens. I
right.
respect the process and use ones that are formulated and tested to make sure it has that SPF. And even those, you have to use a full ounce to get what's on that label. So the DIY thing, I think, looks cute when you're making, your at-home food, but not for your sunscreen.
Hmm, interesting. Going back to beef tallow for a minute, you got me obsessed with that. I thought I heard RFK Jr. Talk about that McDonald's should fry its French fries in beef tallow
Oh,
instead
really?
of seed oil. Yeah.
Well,
So
seed oils we know are not a good thing. I mean, I think all of us know that at this point. Our cardiology colleagues will definitely chime in and say that's true. I don't know beef tallow and its
hmm,
correlation to food preparations.
yeah, I have to look that up. Maybe we could have a whole program on beef
Beef
tallows
tallow.
since
I
we're
think
spending so much time on it.
I think I read something that it has been used in cooking long, long time ago. And
Hmm,
it makes sense. It's beef fat. That's all it is, basically.
right,
So I think it's an animal source of fat. So if you're going to fry something,
right,
maybe it's better than the than the corn, the seed oils like canola and all the other ones.
right. Now, I've interviewed a few psychiatrists on the program, and we talked about the fact that for some reason, young girls are more affected by social media influencing than boys. Have you found that as well?
I think both of them are influenced in different ways. I think it's a different world. Remember, people's phones are in their hands all the time. And so if you're at that age and you are just forming who you are and you see all these filtered images, of people's lives. We show on social media our highlights. No one is showing you their, getting ready, going to the grocery store, doing something like that, just your day-to-day life. I'm not showing you all the hours I was in. I went to NYU for minor in Bope's library, with my stacks of books and not at different events and things. You don't see that. So I think in terms of psychology and these young girls and boys, girls in general, I think sometimes there's a lot of emphasis on beauty, looks, fashion. Boys maybe still, not to stereotype, but maybe less involved in some of those things. I think that's been for generations and that continues.
Right. Interesting. Now, we want to talk about this. This is extremely important. How do all these celebrities like Lindsay Lohan, Christine Aguilera, Donatella Versace look like they have teenage skin? And every time I see them, they look like their skin's getting younger and younger. What are they doing to accomplish that?
Those three look wonderful. I think they're all beautiful women pre and post. They just look outstanding. There's a few things. I want to start off by saying both Lindsay's 38, Christina's in her early 40s, and Donatella is 68 or around that age frame. I think in the case of Lindsay and Christina, we've seen them from when they were very young. And I think we've watched them over time. Both of them, I think, right now are in a very happy personal stage of their lives. Lindsay got married. She has a child now. Christina, they have success. Both have lost quite a bit of weight. I think anytime you lose weight, that helps with the contours of your face. I think being happy and healthy is a big thing. A lot of them are going away from drinking. They have very healthy diets and lifestyles. I can never make you have beautiful, glowing, healthy skin unless you are healthy. You can't outdo not sleeping, eating junk food, drinking tons of alcohol. I can't, there's only so much I can do. And so I think that's number one. Number two, I do think they have had some help. Whether surgical or non-surgical, there's a lot we can do. We have something called HIFU, high intensity focused ultrasound, which is like a lifting procedure that we can do in office. We have something called SalfaWave, which is in that family. We have biostimulators, which help your own body with collagen production. I have classic neuromodulators, which are things like Botox that help with wrinkles when you move, and obviously injectable hyaluronic acid fillers. So I can do a lot to help you non-surgically. And then when you notice, when I looked at some of their images, if you see someone's brows very, very different position, that may be a blepharoplasty, as I'm sure you know, upper or lower or both. I always say when patients come in, and if you start going like this to me, then it's time for me to send you to oculoplastics or plastic surgery because there's certain things, if you need a facelift, like Donatella, I believe has had a facelift. Beautiful one, beautiful work. And then if you look at all three of them, I noticed something. They had a lot of hyperpigmentation pre, meaning brown spots, and now their skin, the universal thing to make someone look younger is not wrinkles. It's actually brown spots, having a uniform complexion. If you look at any dermatologist, pretty much all of us have very uniform skin. Why? We protect ourselves from the sun and we do things to maintain that uniformity. That's what beauty is, I think. It's not just everyone who will have a line here, a line there. I think it's more that if you look at all three of their cases, their skin is glowing. We can do a CO2 laser, which is fully ablative. We can do non-ablative. We can do IPLs, which help, that's intense pulse light to help with those brown spots. We have lasers for red spots. So, in
Wow.
summary, I want to say though to the general public, do not look at those images and think, wow, I'm going to go see, you know, Dr. So and so, and I'm going to come out looking like that. They have worked probably for months, if not years, to slowly, step by step, come up with their procedure plan, their skincare plan, their diet and wellness plan. You know, I think it's very important to for the public. I wish more people would talk about the things that they do because I don't want anyone to feel bad. You can achieve great results for yourself, but understand that they're slow and steady, and it's not one thing that they've done. They've done multiple things over time.
Right. And they're also very expensive, tens of thousands of dollars if you add it
It's
up.
their
Oh,
absolute, and it's their job. If you think about it, the same way you and I are physicians and go to our clinics and see patients, their job is to have a certain physical appearance. And so they invest in that, and it's costly and time consuming. And I think the results that you see are a series of things.
right. Now you mentioned something interesting about stress. The stress, psychological stress affect the skin.
100%. Absolutely. You can have the dark circles, the premature lines, the gray hairs. Stress is our worst enemy. I think all of us are stressed at some level. You know, life is challenging and we have so many different obligations and busy schedules, so life can be stressful. But your sleep hygiene, trying to improve that is really good. Trying to do some form of movement, whether it's walking, anything form of exercise to help with stress, I think is really important. We know for all our organ systems, but especially your skin, it shows.
Right. Another interesting thing about the celebrities we mentioned and many others is many of them will deny that they did anything. They'll just say, "Oh no, I'm just exercising more, and I look 30 years younger." Why don't they want to reveal what they're doing and set an example for other people?
I think this is very generational. I know even in my own clinic, when I ask for before and after for photo consents, The younger patients, they want to film themselves, they want to post it on their TikTok, they want to do all the things and tag me. And then some of my patients, I'd say 40 and above, do not want anyone to know that they've been in my office. I'm not allowed to take any photos, even if I block out their eyes, even if I, pull their hair back. They really don't want anyone to know. And gentlemen, the same. Men are particularly like, nope, don't put my photo anywhere. Say, okay, no problem. I don't know. I wish that more people would share what things they do because then I think it normalizes. I think wanting to look good is part of your overall health and wellness, the same way that you exercise, you eat a good diet, you go to the dentist, you get your teeth clean. Why not want to take good care of your skin and your skin is your biggest organ. And so your skin barrier and taking care of it's important. Not wanting to lose your hair. We have the options now for you to maintain it as long as you can. So I don't see it as vain. I view it as health.
Right. Well, it's interesting that there's a dichotomy there with the different age groups. Let's see what happens with that. Now, one other thing I want to ask you about skin, do the popular drugs now, Ozempic, Wegovy, Zepbound, do they have an effect on skin?
I think so. So the effect that they're having is when you have such rapid weight loss, it depends on the age of the person because your skin has a certain amount of resiliency. Let's say if you're in your 20s and you lose 50 pounds in a short period, your skin is going to bounce back, whether it be skin on your body or your face. In the patients that are 35 or older and they've lost significant weight in a very short time, I'm noticing their face is more hollowed out and they have laxity. So, laxity for the viewers is basically like loose skin, whether of the body or of the face, like jowling. This area you can see it, and they look very hollow. So now they're very excited because they're so slender, they can fit in nice clothing that they couldn't before, but their face really shows it. So for them, a lot of them come in and they're like, what can I do? This is awful. They're so happy, but then I think it's a telltale sign. And so we can do, like I said, the biostimulators, HA fillers. I don't think people should be afraid of fillers. I always say, know who is doing your injections. You should ask them their credentials. Who are you? What is your training? How many of these have you done before? I think nowadays, just about like in Texas, you can go take a weekend course and do injectables, which to me is just awful. Um, so it's a scary, not just from a safety perspective, but also your results. So all those big, awful faces that look strange and odd are a result of inappropriate placement, too much placement, and not doing things staged. Because you can look very natural and beautiful and still have work done. So I think those patients, we're seeing more and more of them, and we will. I mean, I think they're amazing drugs. They're very interesting. We're seeing
Mhm.
lipid lowering. We're seeing, help with blood pressure, heart failure. I'm excited to see like what else are we going to learn that these medications do.
Yeah, Zepbound was just approved the other day for sleep apnea, which
Oh, wow.
is, yeah, obstructive sleep apnea. The FDA approved it for that. I was
Nice.
shocked by that. Yeah, but every day they have more and more benefits and value. Online, I see some of the websites have what's called Ozempic face, and they have certain celebrities on there, and they go, "Oh, you've been on Ozempic," and of course they deny it. I've just been running 20 miles a day, you know. So that's an interesting phenomenon.
I think just similar to the cosmetic procedures, there should be an openness about these. These are not, they're not cheating. Some people do have, we know our society is very insulin resistant. We are sit in cars, we're at our desks all day, our diet. I think that they're not bad medications if done properly. I think more people should talk about what they're doing. For their beauty and overall health. I don't think they're bad. I think more and more people will hopefully admit to what they're doing.
Tell us the truth.
Share. Just share. I don't see any harm in it.
Share. So, for people watching this program who live in Dallas, they now know which dermatologist to see. Obviously, they go see you with all your credentials and background and experience. But what about the rest of the country? If people want a dermatologist who's really good and knows how much filler to inject and where and how much Botox and all the laser procedures, how do people find out what the best dermatologist is or who the best dermatologist is to see?
So there are two wonderful organizations. One is called the American Academy of Dermatology, AAD. On their website, they have you just put in yours, it says how to find a dermatologist. You put in your zip code and you can find people that are close to you. And second organization is ASDS, American Society of Dermatologic Surgery. Same story. You can put your zip code in, you'll find board certified derms. A board certified derm will have a certain title behind their credentials. It's FAAD, Fellow of the American Academy of Dermatology. If you don't see that, it's not a dermatologist. Because a lot of people online, and I was very upset to hear this, you can call yourself a dermatologist, you can call yourself everything. And I was like,
Really?
why? I did not know that there is a particular person, I won't say what state or where, that calls themselves a dermatologist and they're not. And I said, how is this legal? And
Wow.
I guess it is, but I don't know the details of it. So FAAD, and then you can always, my Instagram is at Houshmand MD. If you're in a particular state and you want a good, I'm happy to refer you to excellent colleagues. We're very blessed to have so many wonderful colleagues all over the United States and internationally that I'd be happy to share who I would want to go see.
Oh, that's great. I'm going to put that on the podcast so people can
Perfect.
find it and get in touch. What about you specialize, you do a lot of laser medicine and laser treatments, and that's a subspecialty of dermatology. How do you find somebody who specializes in that if they want to have laser treatments?
I think same thing. There's also American Society of Laser Medicine, ASLMS, and you can look on there and see people there and just ask. I don't think there's any harm if you call a practice and okay, you found your dermatologist and just say, I'd like to do, a laser procedure. I think one of the biggest thing with lasers is you don't want to go to someone who only has one laser. And the reason why I say this is you want to go to someone who's going to pick the best treatment for you. And lasers are very specific, depending on what you want to do, and you may need more than one type of treatment. So I'm saying you want to pick someone that has a plethora of options in treating you. It's the same way for injectables. If you only have one injectable, one neuromodulator, you're going to the wrong person. You want to have someone that's going to pick the best products for you.
How many different types of lasers are there in dermatology?
Oh my goodness. I can't even tell you. There's so many
Really?
different types, and we have new things coming out all the time in different categories. And then remember different skin colors. Not all lasers can be used on everyone. Everyone can have treatments, but you're going to need a particular laser if you have patients of Mediterranean, Hispanic, African American. They're going to need special expertise and care. They can absolutely have lasers. I think it's a myth that people think they can't have a laser, but you want to have someone that's experienced and again is savvy.
So this is where the training and the experience comes into play.
100%. That's very important. And there's no problem to ask, have you treated patients like me before? What are your thoughts? And if they haven't, they can send you to another colleague if they don't have the appropriate device or training. And I think there's nothing wrong with asking.
Right. Now I'm seeing more and more commercials on TV lately about LED lights, and that you put on your face and you keep them on for a few minutes, and they are supposedly great for your skin. What's the story with LED lights?
So LEDs are low-level light laser therapies. You can use them for skin rejuvenation, hair loss. They come at different wavelengths, and basically they're to decrease the inflammation. They're thought to be anti-inflammatory. I'm not against them. I don't think they're well. Many of my patients use them and are very happy with them. Post PRP injections, I do use one in my practice that will place over the patient's hairline to help, or post like procedure, we'll put an LED, like a dome almost over their face. It just helps to calm the skin down, but I
Hmm.
don't think it replaces, there's no skincare. There's no LED, like at home treatments, I think are great, but that can replace some of the things that we do in clinic. Just good old Botox, fillers, lasers, microneedling, all the different things. It's
Right.
a different procedure.
Now, one more thing. You mentioned PRP or platelet-rich plasma. What do you use that for? That's becoming very popular, not only in dermatology, but in orthopedics and other specialties.
So they were actually ahead of us. So when I first graduated, I was very interested in PRP because I had heard from my European colleagues and South American colleagues what they were using it for in dermatology and cosmetic surgery. But in reviewing the literature, it was actually first used in orthopedics, in spine surgeries, joint surgeries, knees, and they found higher recovery time. It's also used in endodontistry for gum rejuvenation, which was very interesting to me. So it's been around for years and years, but in the last, I'd say 10 to 15 years, it's been used in the cosmetic space as a almost your own natural filler. And what I like so much about it is that it does go away quicker than a hyaluronic acid filler. It helps, if you think about it, it helps to strengthen almost your underlying tissues to give you a little bit of subtle volume. It's not a wow effect. It's very subtle. It's great for under eyes or this area. And I love it for hair loss. For hair loss, it's just you basically do one treatment a month for a minimum of 3 months. And you'll start to see hair growth about 3 to 6. And it helps because you're basically giving the growth factors to the hair follicle. And it's a game changer in the world of hair loss.
Is this male pattern baldness hair loss or just hair loss from aging?
Both. So
Oh,
the hair loss from aging is helpful, and it's also helpful with male pattern or female pattern. Now, who is it not good for? If
hmm.
you have a completely bald head, no. Then I need to send you to one of my colleagues that does transplant. But if you're someone that has thinning or a receding hairline, then yes, I can absolutely help you. But if you have any sort of scarring alopecia, autoimmune disease, that it won't help. You have to have just androgenetic alopecia, which is the hair loss due to aging and genetics, the being the most common. But it's a wonderful treatment. We do that a lot in office. It hurts. It's not painless. Hurts a lot. It's a lot of needles that you inject into the scalp,
You
but
don't inject lidocaine first to numb it?
you can do topical numbing. Some people
Right.
use Pronox or laughing gas for the
Hmm.
treatment, but it is very painful. I've had some
Oh,
patients say, I think it's a 10 out of 10 pain, but well worth it to get your hair.
right. If your hair grows back, I'll go for 11 out of 10, right?
There you go.
So this has been extremely informative for me, and I'm sure the audience out there as well. I want to do another program with you to discuss hair loss in more detail, and also microneedling, which everybody is having done as well. So we'll do that in another show. But I'd like to thank you very much today for taking your time to appear in the Doctor Podcast program and telling us about dermatology. And this has been very helpful for many people.
Well, thank you so much for having me. Absolute pleasure, and look forward to joining you again.
Thank you.
Thank you. Good evening, everyone. Bye-bye.